the Global Fund's biggest investment in terms of donation for healthcare, but the country still faces significant challenges with stemming the tide of HIV and AIDS, tuberculosis and malaria. It is expected that about $14 billion will be raised at the upcoming Global Fund 6th Replenishment Conference in Lyon, France. This is expected to help save 16 million lives, avert 234 million infections, and help the world get back on track to end these diseases by building stronger health systems by 2023. TVC's Kemi Balogun has more in this report.
Programs and projects supported by the Global Fund Partnership have saved more than 32 million lives globally. The Global Fund is also the largest multilateral investor in health systems, investing about $1 billion every year. In Nigeria, the key areas that need funding remain the three major public health threats, which are HIV and AIDS, tuberculosis, and malaria. The UNAIDS and the National Agency for the Control of AIDS estimate that there are about 1.9 million people living with HIV in Nigeria, which accounts for more than 200,000 deaths. Malaria remains a risk to 97% of Nigeria's population. There are about 100 million malaria cases, with more than 300,000 deaths per year in the country. Tuberculosis accounts for the deaths of 4,500 people on a daily basis, and about 30,000 people fall ill from the preventable and curable disease.
To address funding gap is universal health coverage and to have health insurance. Currently, as a nation, we have no special hospital for hypertension. We have no special hospital for diabetes. We should not have also special hospital for HIV. But when we mainstream it into the health agenda, it will be taken care of in all hospitals.
Nigeria needs more investments in health, both from the domestic and international sources, and this remains a concern for the Africa Health Foundation, who are using this time to call on the world to step up the fight against HIV and AIDS, tuberculosis, and malaria.
If the funding is available, then more people are going to get tested, more people are going to be placed on treatment, and then we can now achieve that aim that we have. So at the end of the day, what we need in identifying persons is funding. And so we're calling on all countries, all governments, including ours, to ensure that at this 6th replenishment, this target of $14 billion is met.
It's very important that we as a government, we as a people, as civil society, will continue to enlist a number of countries to make sure that they make significant contribution to the fight.
So far, in the fight against HIV and AIDS, Nigeria has succeeded in putting 1.1 million people on treatment. UNAIDS also estimates that for the year 2020, $26.2 billion will be required to end AIDS as a public health threat by the year 2030. Kemi Balogun, TVC News, Abuja.